Welcome to Eureka Health Podcast. I'm your host, Toby. Join me today in welcoming a UK registered nurse, originally from Kenya. And she has built a remarkable journey, transitioning from a nursing career in Kenya to life and work in the NHS in the UK. There are a few changes in the immigration department regarding ILR timelines, and these shifts may impact our lives. Would you mind just introducing yourself?
My name is Sydney Omondi. I'm from Kenya, and I'm a registered nurse now in the UK, work in the NHS. Was a Kenya registered nurse in Kenya. And so this is what I do here.
So, how long ago did you move to the UK?
It's 4 years with some months because I'm due to renew I'm due to have my ILR done next year. So I can't tell. Let's just say 4 years roughly.
Okay.
Yeah. So I've been here for 4 years
Yeah.
from home.
Yeah.
I've just kept abreast with everything that's happening, honestly, because I don't want to miss any important information concerning the ILR thing. Yeah.
I know. Especially you're just near the 5-year mark, so
Oh, I am exactly.
I can imagine how much you are invested in following the details of every single change that is taking place.
The anxiety that comes with it, only God knows.
I know. Wow. So the recent ILR changes, it has always been 5 years for health professionals, and I mean for generally for most immigrants, except for the business route. Innovator business route was, I think, 10 years, but now it's reduced. But then the law is now sort of changing based on the immigration white paper that was first discussed earlier in the year. It was introduced. But now the ministry, the immigration docket is now honing in on it and changing it now from 5 years to 10 years, generally for migrants, basically, who came in after 2021. So what's your view on this?
I think that's the thing that I've been keeping an eye on, literally, because this is where I'm headed to. And I just didn't want any change to pass me without knowing what's going on. And as you can see, at some point I would ask you, I would text you, do you know this is happening? Do you know this is happening?
Yes.
I remember till the 20th when all these big changes were made, I had to send a couple of people the link. And you are one of them, actually, I did send the link to. Yeah, because I am due to get my ILR, and I'm doing this in the next year, hopefully, God willing. Still hoping for the best, because this country, only God knows. Only God knows.
Things keep changing.
Things keep changing in this country. I was telling one of my friends, that this is the only country that doesn't have written laws guiding it. This is a country where they wake up one morning, somebody dreams about something, then they propose it to the parliament, and then the parliament is there sitting and debating on it, and the next minute it's passed as a bill. It's passed and it's working. And I'm thinking, how the hell does this work? It works in the UK. It works in the UK. So I feel like it's a betrayal. It's a betrayal, honestly, to healthcare workers. It's a big blow. Because I don't think, as much as I know they are trying to minimize the movement of immigrants to the country and all that kind of thing, they're trying to cut down on the numbers of people coming in from whatever areas. It's a big blow to the healthcare sector. Or to the health immigrants. Because look at the people who came during my time. Because I'm at 2021. I came in 2021. So we are the people who are due to have our ILRs done next year. And then I'm trying to imagine guys working in care homes. I'm trying to imagine guys working in the private hospitals.
Yeah.
In the hospices.
Yeah. For those who are wondering why it is very important the difference it makes to have indefinite leave to remain.
Yeah.
When you come in as a professional or as a migrant working in the UK, there are certain conditions or restrictions that you are faced with. One is that you have to stick with your employer. You have to stick with an employer that sponsored you. And
Okay.
if you have to change your job, you have to get another employer who is willing and ready to sponsor you as well.
That's correct.
Yeah, so you have to be tied to an employer.
Yes.
And which I find the people who are the luckiest is dependents. Dependents are very lucky. They are not tied to any employer. They can work wherever they want. They can, if they decide they will not work, if they decide they'll open a business, they are very much flexible. But the primary applicant is tied to an employer.
Yeah.
And then the other thing is that you are not subject to public funds and benefits.
Yes.
So you won't have any benefits or public funds until you get indefinite leave to remain at the moment. But then with the new changes, even with indefinite leave to remain,
there you go,
you will still not be able to access public funds and public benefits until you get until you become a British citizen, which is after another 1 year.
Yes.
So it's a total of 6 years. So 5 years to ILR and 1 year till you can apply for
citizenship.
British citizenship or a British passport. Yeah, so it's really, really important. And if that is to be moved from 5 years to 10 years, that's really a step that will affect many, many people.
Many people, honestly, many.
Yeah.
It's quite a big blow, like I've said, and like I've said, it's just our luck. It's just by luck that we are working for NHS, because these are the only exceptions that have been given, and these are the only people that the 5-year thing is still working for.
Yeah, NHS doctors and nurses were
they were exempted.
Yeah. With the current change. But again, it keeps changing. You never know. I mean, it keeps changing. It could get better. It could get worse.
Yeah.
Whenever there are issues to vote about,
we need to do it.
You need to express your opinions. And I think many times there have been links shared on people to express their opinions about these changes. So we really have to express our opinions.
Well, like I said, I'm just trusting in God that next year just happens as it is. Nothing changes, because I just can't imagine myself sitting again for another 5 years waiting for all this, because sometimes you need all this freedom.
Yes.
Like Toby says, you're quite tied down. You're quite tied down, because look at us. After initially, it used to be after 3 years, your employer can renew your visa or not, and that means they give you a new certificate of sponsorship to continue staying with them. Or if you wanted to move to another employer, they would be willing to give you a new certificate of sponsorship to continue working for them. And this is not what we want. We want to reach a certain level where you can just decide to, I want to go to London, I want to go to Watford, I want to go to Birmingham, I want to go to Scotland, and you just do it out of your will.
Yeah, to change your employment.
Yeah. So it becomes so easy.
And also to explore your passions. Maybe you want to venture into business or a different working environment. Yeah, so those are the benefits that the ILR and British citizenship offers you. But now that period is being extended now before you can qualify for that. Yeah, so it's something we are really keeping an eye on. And
I know it's going to affect so many people, because I don't know, even before all this started, I think I'd already had stories from nurses saying that I don't think they're going to take all this crap. They call it that way. The union's not gonna take all this shit anymore because they've got the skill that is needed elsewhere. They're gonna have to leave for the place that that kind of gives them the benefit of doubt.
Yeah, where the bread is buttered more.
Yeah.
Actually, and there's a bit of migration to Australia, USA, and a few other countries. Well, but I think the system is all similar.
Well, it's all the same. And if you keep if you're somebody who keeps abreast with whatever happens in all these developed countries, you'll notice that they're also tightening their immigration spaces. The routes are being tightened.
Yeah.
And then the earlier you want to do something, the better for you.
I know some perspective on that, but we'll keep an eye and we'll keep you informed of any further changes in future podcasts.